Let's go ahead and get started. So HAC, as many of you know, stands for Housing Action Coalition. The HAC series is a monthly discussion-based and action-focused event hosted by Silicon Valley at Home, which we typically have on the fourth Friday of every month. It's meeting style by design to try as best we can to capture the feeling of meeting and interacting in person. In that spirit, we do encourage you to keep your video on, please, if you're able to create as much of a community dialogue feel as possible. So we do have some ground rules. We'd like to ensure that the conversations and the relationships here today remain respectful and productive. So we do ask that you please be kind and courteous to each other. We don't tolerate rude comments or personal attacks. We encourage asking questions and listening. Both are active components of learning and engaging with each other. We do find that sometimes the chat can get lively. If you find that it's distracting you from the content of today's discussion, we do encourage you to consider closing the chat temporarily. Please remember that today's conversation is focused on housing as healthcare, and keep comments and questions on topic. So I will turn it over now to David to introduce our speaker.
Great, thanks, Allison. I'm David Meyer with Silicon Valley at Home. I'm really glad that we have Darius Young here today from BARHI. That's the Bay Area Regional Health Inequities Initiative. As Allison mentioned, he's the impact manager for African Americans and Pacific Islanders. We're going to be talking today a bit about the connections between health and housing, as well as some of the kind of broader connections to, I think, housing justice and health justice and how these things all intersect, and the work that BARHI is doing at a regional level. I think this is a really critical topic that we at SV Home think a lot of time talk a lot about how, we want to talk more about this, we want to learn more about this and talk and do a better job of drawing these connections between health and housing. And so, this is one step in that process. We hope to be able to continue these conversations just because of how important we know that housing stability is to people's health outcomes. I think the majority of research that has been done around this topic has been really focused around improvements to people's health outcomes, people who are experiencing homelessness, and the health, major improvements to their health outcomes that comes from having a stable home. And so there's been a lot of research done by that. It's really served as the basis.
Hi, Richard.
For
good. How are you? Yeah.
But I think that's really served as the basis for a lot of the work that's been done, especially by Destination Home and others focused on creating permanent housing opportunities for people experiencing homelessness. But there also has been a bit of research done on kind of more direct health connections between general deed-restricted affordable housing and the positive health outcomes that come from people who have been able to actually have housing that's affordable to them, and what it means for people's ability to be able to better access primary health care, be spending less time on housing that they can spend on health expenses, and many other aspects of that. So, of course, the pandemic has only further highlighted these challenges, and I think we're going to probably touch on that a bit today. Obviously, our unhoused neighbors were at extreme risk of COVID-19. And also, I think one of the most interesting and important things that's been highlighted has been around the additional impacts of COVID-19 and the increased mortality that we've seen, especially in places like San Jose, amongst our, quote unquote, essential workers, the people who have been doing the jobs to keep our economy running, disproportionately, especially in San Jose, Latinx communities, east side of San Jose, where we've seen, increased mortality and people, being impacted by COVID-19. And so directly being impacted by, and how that, in a lot of ways can be drawn back to people who might live in multi-generational households, or who might be living in conditions where there might be overcrowding, and putting people at more risk because they're being forced to, look at kind of do everything that they can basically to find somewhere affordable to live, and that's put them often at more risk of COVID. So there's a lot of different issues that we can talk about and cover, and these connections, I think will probably only get to some of them, but I think one thing is clear is that we can't talk about health and housing impacts connections without talking about race and race in the Bay Area and disproportionate impacts that are being felt by BIPOC communities of color. And so we're really excited to hear about all the work that Bar High is doing, kind of looking at the intersection of all of these issues. And I think with that, I'm gonna turn it over to Darius. And then, after Darius has had some time to share his expertise with us, we're going to go to some questions from the audience. So if you have questions as we're going along, as Allison mentioned, please feel free to put them in the chat, and we'll go from there. So Darius, thanks so much for being here.
Thank you for inviting me, and it's a pleasure for me to be here amongst you all today. So I'm just going to start off by giving you a little history of who Bar High is. So Bar High, which stands for the Bay Area Regional Health Inequity Initiative. We are the coalition of the Bay Area's government public health departments, and we were founded to work on the issues of health that exist outside of the doctor's office. And one of the things that we do know is that one of the biggest drivers of health inequities is housing. And I would say that 5 years ago, when we convened the local health departments in a conversation, issues of housing affordability was a top concern. And we also did a report for the Federal Reserve that showed that housing issues were region-wide, not just in the 3 big cities, which we consider Oakland, Berkeley, and San Francisco. When we staffed the equity kitchen cabinet for CASA, we found that leading to rent gouging, and we were able to put forth a measure, right, that led to anti-rent gouging statewide. So in this work, as we began to apply into this work deeper and deeper, one of the things that we saw was a Black voice that was missing from the conversation about what would create healthy options for African-American population. And we know that as a region, we've seen a decline in Black population. But there was no strategy to deal with that. Now, David just highlighted COVID-19, and I want to be able to present this information, right, in a way that it makes sense, right? Because there's a lot of parts that go to this conversation when you enter in COVID-19. So we know that, when we started out with COVID-19, we started seeing a lot of disparities region-wide with the people that were actually becoming infected with the disease and those that were dying from it. Region-wide, the Latinx population had the highest amount of infections, and then there were the Pacific Islander communities, and then it was African Americans. Now, amongst those communities, African Americans were dying at a higher rate, as were those from the Pacific Islander communities. It would probably, it's going to make some eyes bulge, but I think statistically, when you talk about population-wise, the Pacific Islander communities have the highest death rates. And so where does all this tie in? Give me a minute and I'll get there, right? Because one of the things that gets left out of this conversation about health inequities, housing, and how that impacts the overall conversation, I think that, last year I was engaged in a lot of research. And my research was actually founded on what we call reimagining public safety. I was charged with creating a brief with this. And which will soon be released. Okay, a little late, but we are getting it out. But one of the things nationwide and within the conversation is that we see COVID-19 on this end. And then at the same time, we saw the 2020 summer uprisings behind George Floyd. And what was so ironic about the two, they converged, right? And both of them, as they converged, and I don't like to use the word exposed, right? But they lifted the veil off of the conversation of the disparities that were actually the drivers of what we call over policing in certain communities, right? And also the health disparities that were happening. So you saw this convergence. And the other thing that I would say is this. In March of this year, the California State Assembly, they had a hearing that was chaired by, co-chaired by Assembly members Chu and Grayson. And it was called Addressing Racial Disparities in Housing. And I think that one of the things that was really, really important as they had this hearing were the number of statistics. And I don't have a PowerPoint, but I want to share some statistics with you. And then I can also probably share the link if you all want to go back to the, some of the things. But what they found was this. We know that until the mid-19th century, federal, state, and local governments, and especially here in the Bay Area, allowed for and oftentimes mandated practices that encourage segregation by race, and government sanctioned policies that also included redlining, the use of racially restricted covenants, and permitting actors in the real estate market to engage in overt discrimination. And so one of the things that I became really, what was really kind of mind-boggling to me, and I actually shared this with David when we had our pre-conversation. I told him of the fact, I grew up in the 60s and 70s, and I actually grew up in Berkeley, California. And I actually grew up in what was that time, what I thought was a pretty diverse community, right? It was a community, the block, or that whole block that I lived on, it was fairly integrated. There were working class, middle class families and neighbors. But what I didn't know until recently, that is in 1916, Berkeley was among the first cities nationally to establish single family residential zoning, which the city has acknowledged has its roots in racist exclusionary zoning policies, right, and segregation. And so some of the numbers that we see in home ownership was that, like the nation as a whole, right, home ownership rates among communities of color, I would say the data says that 65% of white Californians are homeowners, while Asian Americans have a home ownership that is 6 percentage points lower at 59. But we know about 1 in 2 Californians of Native, Indigenous descent are homeowners at 49%, while the rate of home ownership amongst the Latinx population is 44%. And then Black Californians have the lowest rate of home ownership across any racial ethnic group in California at only about 1 in 3 owning homes. So one of the things that we know as we focus on home ownership, and I want you to understand this, that is a key. But in the conversations that I'm hearing now with home ownership, without talking about affordable rents as well. Rental gets left out. And I think this is where we connect that aspect of where COVID-19 hits. So according to a recent report by the California Budget Policy Center, In 2019, roughly 60% of Black Californians and over 53%, right, of Latinx Californians lived in rental households compared to roughly 35% of white Americans. Now, not only are Black and Latinx populations are more likely to be renters, but Black and Latinx California experience the cost of the burden at a higher level than white Californians. Now, what does this mean? Why am I highlighting rental? Because we do know we've been fighting for moratoriums on, rents right now so that people will not be evicted. Now, if there's no other remedy, right, than temporary moratoriums, guess who's going to be out of homes, places to live more than any other people in the Bay Area? That would probably be our Latinx community members and our African American community members, because we do know that at the rentals, and what it means is that, as people become, up for eviction, it's going to exasperate those situations that already exist that has led to homelessness, people couch surfing, and then more and more people in the era of COVID-19 may be living in more crowded spaces with relatives and friends, which we do know that we are actually not out of the woods when it comes to the virus or what we're dealing with now in COVID-19. So to tie all this in, where do we look at for these policies that will allow individuals, people, to be able to have stable housing, affordable housing, that will not only lead to better health outcomes, but also economic development outcomes, educational outcomes, and those other things that gets left out of the conversation as well is how those things tie into the criminal justice population. Because we do know that people that live in substandard housing or no housing at all are those most likely not to exceed educationally. And if you don't exceed educationally, graduating from high school or graduating with with a grade point average that allow you to get into some type of trade school or university, then we know that most of the time individuals end up going into incarceration. And then another aspect of this, and I want to cover all sides of what we look at through housing, because I do think that this is one aspect that gets left out of the housing conversation. We are talking about transitional age youth. And these are young people that actually age out of the foster care system. And what I didn't know until recently is that the overwhelming, I think it's 65 to 70% of our young people that age out of the foster system in the Bay Area, they become homeless. And then of those 65 to 70% that become homeless, another 45% end up in incarceration. And so once again, that goes to future opportunities to be able to rent and buy housing, buy homes, even if there are more affordable housing opportunities that are. And then we go back into how it drives up the health disparities, which is, in African American communities, our life expectancy rate is 10% lower than most. And then that's followed by our Latinx community, then our Pacific Islander communities, right? And this is drawn across all lines. Some of those disparities, some of the things that come up are, and it's not readily connected. But when we talk about life expectancy rates, we're talking about things that drive, like, asthma, things that drive heart disease, things that drive other type of diseases that are born out of stress and trauma. things like diabetes, high blood pressure, and then those are the drivers of things that lead to other things that impact our health, which are obesity, addictions, and the whole gambit. And I know that as we look across the board, one of the things that we talk about is housing. But what's left out of the conversation in housing as a health disparity is how do you develop strong, healthy, vibrant communities when it comes to people of color. So it's not enough to have housing in different areas, but there needs to be investment in other areas too, like for instance, recreational places, right? That gets discounted. We don't talk about parks, recreations, safe places to walk, places that are environmentally safe and they're not impacted by environmental situations where you have pollution, all these things that once again go to health disparities. And I think that I like to drop different like ideas or links, but if you haven't seen it, and for those that are really, really interested in health, it was a nice documentary that came out maybe about 6 or 7 years ago. It could be older now, but my recollection, the name of the video is called Unnatural Causes, right? And it focuses on health disparities of people of color. And if you've never seen that documentary, it's really, really eye-opening. And it not only talks about environmental health aspects, but it also talks about how racism impacts health as well. I don't know if that gets left out of the conversation much, right? And especially when it comes to women of color that are pregnant and experience racism in overt or non-overt ways. This documentary, it shows how it impacts that fetus as well, right? And so when we talk about what are some of our solutions, right? How do we look at this? Well, Bar High last year in the midst of COVID, one of the things that came up for us was we knew that there were things being done in other communities, but like I just said before, there was no plan to reverse or address what was going on, like the strategy for African American communities. So what we did was we started having conversations back in mid-summer of 2020 with Black developers, CBOs, Black housing advocates, to get a sense of, what housing and other services that were needed in underserved communities. By May, we convened 35 African-American-led organizations throughout the Bay Area. And we had a convening on a strategy for Black housing, and it covered everything from homelessness, it covered developers, it covered entry housing, it covered every aspect of housing. And what we did know is that during that time in May, we felt that in California and throughout the nation as a whole, we were in this historic moment. And I call it this historic moment because we had the great big American Rescue Plan come down, which I think brought forth $1.9 trillion. And if I'm not mistaken, that's the amount that came to California, which was that was in the ARPA plan itself. And we felt that in California, with the amount of money that was coming down through the ARPA plan, along with California's historic, and it was historic, budget surplus last year, that we could find a way to come up with some mechanisms to address the disparities in Black housing. And if we did that with Black housing, then we know that it would also impact the disparities that we're seeing with our Latinx community, as well as our Pacific Islander communities, because we know that this intersectionality, what impacts one, impacts all. So we came up with the strategy, and we asked the state of California to help us catalyze the creation of a regional Black housing finance pool to the tune of $500 million. Now, that might sound like a huge lump sum of money, and it is, but it's small in retrospect to the need. And so one of the things we were working on was we want to see down payment for assistance for Black home ownership, pre-development acquisition and rehabilitation funds to accelerate development for existing pipelines. And we also, one of the things that we wanted to see from this is also how to, fund set up for communities to be able to address, high rent areas and not be able to stay in areas because rent gouging and affordability goes up. And so one of the things, that I'm hopeful for is this moves, but this put a little bit more context to the housing situation and where we're at now, housing and health. Probably most of you that are on this call this morning, like most people that I have ran into by now, they have read the book, The Color of Law by David Rothenstein. Great book. And I think people say, oh, he lifted the veil off everything. And he did a great job of highlighting what housing policies did. But I found it ironic that he started the book off in the Bay Area. And that was ironic to me, right? He started it off right here in the Bay Area. He talked a lot about how Santa Clara County's housing became so disproportionate. He talked a lot about how other housing aspects became disproportionate for people of color, not just African Americans, but people of color in a whole. And that he also talked about how some of those links were actually established between, what we look at as health disparities. And so one of the things is this, we did have a problem, and it's getting better, with our children being exposed to lead. Early on, it was this theory that, oh, they were eating the paint off of the walls, right? That's further from the truth. The truth is that most of our communities, Latinx communities, African American communities, they were built in the middle of freeways. And with that of leaded gasoline during that time, that helped to bring about these big disparities in lead poisoning amongst our young people, right? And so what I guess one of the final points that I would like to make is that when we talk about health disparities, we can't leave out housing. And the other thing is that when we talk about equity, right, because I hear that word more often than not, all the time, right? I personally, and this may seem like a shock, but I didn't really start understanding equity until maybe about 2018, and I went to the big equity conference that was put on by Angela Glover Blackwell, the founder of PolicyLink. And it was in Chicago. And that's when I really came to grasp it. So the question is this, as we talk about equity, right? Do we truly ever get to equity? And when you picture equity, you picture three groups of individuals standing on the box. You see African Americans, you see Latinx, and you see the white population. And they're standing higher. They're looking over the fence. But then you get the next community, they're getting to the top of the fence, but they're still looking over the fence. And then you got African American communities, they're at the bottom of the fence trying to look over the fence. The question is this, though, as I began to think about that, how do you ever get to equity if every time you make a climb closer to the fence suddenly grows and gets higher? And I never thought about it, but it grows. Policy makes it grows because we continue to look at and create policies that make sure the status quo remains the status quo. And so as you get closer to the top, we're looking over, another policy happens here, another policy happens there, and then that person is still climbing over to look over the box. And the overall impact of that is our health disparities. And I would say that in an era in the world where we talk about COVID-19, and we talk about that we live in a time now where we do, most of us understand, or should understand, that we're going to have other. We are going to have other variants of this disease and other, because that's the type of, that's where we are now, right? And so the question is, going into the future, are we going to be the ones who prepare for it, get out in front of it, and create communities and situations where people won't be impacted by the next virus that comes around, or the next disaster, or anything else that comes around to limit people's ability to live as human beings in our society? And I would say the last point I would leave you with is this. I've only just in my young age, and I'll just say I'm only young because my last name is Young, but I've recently had the opportunity to begin to travel. In 2019, I went to Ghana. And most recently, I just traveled to Egypt. And when I came back to California, came back to the Bay Area, what I saw was that, wow, highways, underpasses, overpasses, behind, there's so many people living in homeless encampments, right? And I'm thinking like, wow, you know, and people over in those other countries, they don't have half the resources that we would have or what our governments give. And it looks, and it just reminds me of where we are. So it's almost like in some parts of the country and in the Bay Area, different communities, we have a third world population in the midst of, well, the richest nation in the world and one of the richest states. And somehow that shouldn't be. And so when I think about what are some of our solutions to this, is being able to look at policies down the line that keep people locked in certain places, and that we could distribute resources. We have enough equity-wise to be able to do that. And if we did that, then I think that everybody benefits from it. Because I do know, and I shared this with David, you know, I felt like growing up, things were different for me, in a sense, as African American. You know, I had two parents that worked. Both of them were civil servants. They were able to buy 2 homes with 5 children as civil servants, right? You know, they didn't make a lot of money, but they were still able to do that. And so how far have we fallen when people, right, who work every day can't afford housing or even rent? Something to think about. Thank you.
Thanks, Darius. You definitely give us a lot to think about. I think that what I really appreciate most about your perspective and about the Barhai perspective is just really taking a look at so many different aspects of policy and our society, and realizing that it's difficult to kind of, we can't tease them out and kind of treat them individually, right? I mean, we subtitled, or we titled this discussion today as housing and health, but the more that we talk about it, the more it becomes, how it's difficult to just say we're just going to talk about how just these two pieces interact without talking about issues of race, issues of larger, basically development issues in our communities in terms of other resources and access to resources, and all of those different things are all having impact on people's ability to be healthy and to live healthy lives. And there's all kinds of different things we could probably dive more into. One thing that I wanted to make sure that we address or talked about is I'm not sure if you might be able to share a little bit more about this one Barhai initiative that's called the 8 Essential Actions. I'm gonna which is related to what you brought up related to the eviction cliff, and the fact that there are so many people who, as the eviction moratoriums have ended, have been at risk of being evicted and losing their homes. And Barhai actually is leading this initiative. Oh, there it is. Allison posted it in the chat. Which is basically a list of policy items that Sweet Home is actually a supporter of the 8 Essential Actions, but it's policy items that we need to advocate for cities, jurisdictions in the state to take in order to further protect people who are at risk of eviction. And I think this is all, this all ties directly back to, to people who are disproportionately impacted by COVID. And then we know that, if people lose their homes, that's going to just even further, undermine their ability to access healthcare, to live healthy lives.
So one of the things we came up with what we call 8 essential actions that the Bay Area could take. And that's for preparing for the COVID-19 eviction and foreclosure cliff. And so we came up with 8 things that we think that gets us to this point to where we can address it, and that we can be prepared for when it happens. And so one of the things, the first is that of the 8 essential actions for community readiness. And we want to prevent evictions and foreclosures. So how do you do this? Well, one, we need to expand just cause protections. We want to expand debt relief. And then we also want to talk about homeowner relief as well. The next category is to educate, inform, and advocate to make rights and relief real. And I think the key points in that one is educate and inform, because so many people aren't educated and so many people aren't informed. And so that number 4 essential is under this is how do you, it's to fund community education and organizing. That's so essential. And then conduct robust targeted outreach and communications. That means we have to get there on the ground and give people the truth of what's going on. They have to know the remedies and things that are out there. The next category is to prepare our systems to respond. And so that leads us to number 6 and 7 of the 8. That means to fund legal services so that they can give people, consultation, because most people who don't have that, they don't know, and then they're left out in the cold, literally. And then number 7 is work with local courts to adjust court policies and practices, because there's a lot of court things that are going on within the courts that have these policies that prevent people from underserved communities really from having like the access that they really need to get to the courts in order to do the things necessary to move their cases and claims forward. And then under the last one is to demand state action. And that leads to number 8 of our essential things to do. And that's to pass resolutions urging the state legislature and judicial council to take further actions. And so it's not enough to have a moratorium here, a moratorium there. There needs to be what we look at as this longer term, policies that help us to deal with where we are at now and prevent other things like this from happening in the future.
Yeah, thanks, Darius. We
You're
usually, as part of the hack, give everyone an action that we want them to take, and we're usually do it at the very end, but I kind of maybe preempted myself a little bit. But we do really encourage people to go to that link, to look at the actions and to look at the implementation plan. And there will be more upcoming opportunities where SV at Home will be highlighting specific places where people can advocate on pieces of this, pieces of these actions, because some of these are pieces that are going to need to be advocated for individual cities. Some will be state level pieces. And so those will be things that, as long as you're a SV at Home newsletter subscriber and you get information from us about upcoming advocacy opportunities, these 8 essential actions will help guide our kind of a framework that are guiding some of that advocacy work. So I think I see a raised hand.
Yeah, that's me. So hi, Darius. Thanks for taking the time and sharing your thoughts on housing and healthcare. You said that about a year ago, or within the last 2 years, you were part of a program that you went to the state and asked for the $500 million. And I'm super curious because I think that that's a very interesting strategy, and if it's funded and executed properly, can certainly help. How was your experience with that, and what would you have done differently knowing what you know now?
Well, it's still evolving because the strategy was just created back in May of this year. And so we're in conversations right now with the state. And one of the things is that as we evolve this strategy, we know that right now it's a prime opportunity because California has set aside tons of money this year that impacts us, I think, throughout next year and maybe the next for housing, right? And so, but the question is this: how the strategy that we are working with, and I think the barrier is that we are trying to figure out now is that how do you get this money into the hands of the most of the people that need it, right? And so, like for instance, if we just say, well, we're focusing on African American communities and Latinx communities, then that leaves out other people. And we know that we have fair housing laws and also Prop 209 when it comes to developers that prevent us to do this. And so what we're working on now, and I think what I'm learning now, is how do you package the language, right? How do you package that language? And I would like to say this. I'm a fan, or I know a lot about the Fair Housing Act, because as a young man, a young kid, I was a kid at the time. And I'd just like to share a story. I went to the barbershop and I would listen to the old people's conversations, more or less. And it was this man who came in here. I really didn't know who he was, but his name was Byron Rumford. And Byron Rumford was actually the first African-American politician in California. He was a pharmacist, a prominent businessman in Berkeley, California. And it's a statue that he has on the street, Sacramento Street today. But he was the first one. He created fair housing legislation in California. And that blueprint for fair housing actually became the blueprint for what the federal government. Now, what's ironic, and I say this about this, the Fair Housing Act and laws were actually, they were created for African-American people, right? But now that same law is being used against us for directly targeting African-Americans, right, for housing. And Prop 209 limits us to helping Black contractors be able to get contracts, own their own projects, which also goes back into building community wealth. Because I think when we think about housing and the people who benefit from housing, they have generational wealth and community wealth, right? And that has to be components of the conversation itself, because all those things lead to better communities, better places, and better health. So I hope that answered your question. It's an initiative, it's a project that's still evolving, and we are just now working on. But I would say that in every aspect, at the state level and at the county level, we have a lot of interest coming from the state legislature, assembly person, and also some of our county officials are very interested in the concept of what we're trying to create. So I'd say, but I think there's still a lot more learning that we have to do as well. And every day is a learning experience for them.
Okay, thanks. Yeah, it makes sense. It sounds like a challenge for sure. But I appreciate your thoughts.
You're welcome.
Darius, I'm wondering, I know that you've also specifically mentioned Pacific Islander community, and that's also a part of your work. I'm curious if there are specific initiatives or work that is being undertaken related to either health or housing needs specifically related to Pacific Islanders. I think you've already touched on kind of this important point about how, there's this challenge of how do we help specific communities that have been, over generations disproportionately impacted and have, specific needs and challenges, but at the same time, how do we take actions that are going to help communities as a whole? And so I'm curious in the work that you're up to, if there are specific initiatives or work on kind of the Pacific Islander front as well.
So what's happening with our work in relation to the Pacific Islanders? The Pacific Islanders, they have a task force that they've been involved in. And we've been acting as kind of like a go-between. One of the things that we know which hinders their population, and I was just in a hearing, it wasn't in Santa Clara County, it was in Alameda County. And it was behind the American Rescue Plan Act dollars. And everybody was vying for those dollars. And one of the things that happened with the Pacific Islander community that was over there is that, and it keeps happening, and is that their data statistically is not disaggregated from the Asian population. And so because of that, right, they get lumped into what we look at as like actually, they get seen with better numbers. And so their disparities aren't as pronounced as should be. So I think that one of the things that we have been fighting for and keep needing fighting for is how do you disaggregate Pacific Islander communities from Asian community data. And I think once that begins to happen, then you get more emphasis on things, on how monies should go to different communities, where are the burdens, where are the needs. And I think that's the most fundamental thing that when we're dealing with Pacific Islander communities is making sure their communities are adequately resourced, right? They're community-based organizations, all those things that help their communities remain vibrant. If they're not adequately resourced, then what happens is that you can't deal with the disparities and all the other things that are happening from a grassroots level. And so that's the main thing.
That's great. Thank you. Yeah, I mean, especially in Santa Clara County, I mean, I know that there's a lot of challenges around disaggregating because there's such a large Asian American population, but there are huge disparities across different people with different types of backgrounds. And when
Right.
you take these groups as one big chunk, you're missing needs that are in specific parts of the community.
And yeah, and unfortunately, that becomes our Pacific Islander community, you know. And yeah.
One thing I want to just share, just because, you know, I think you brought up issues related to lead poisoning and really kind of these environmental inequality, environmental racism, basically, of where housing's been located and the, you know, just quality of housing and how that's impacted people's health in long-term ways. And I think one thing that you may have read about and that people who live in Santa Clara County probably know about is that there's been this very, it's been a pretty long process so far, and there's still a long process to go around the Reed Hillview Airport, which is in East San Jose. And just, what was that, 2 months ago, the final report was released related to lead poisoning in children, and it was found, obviously, that the airport and the lead gasoline and those planes coming in all the time had directly, you know, was poisoning children. And of course, the children who live around there are predominantly, you know, Latinx community around the airport. And you know, SB Homes has been, you know, strongly supporting the community organizations that have been working for a long time to try to get the airport closed. And you know, we're really looking forward to, we're you know, advocating with the county that the county should be, you know, not only do we support the county closing the airport, but there needs to be some kind of, you know, robust community process to determine what we're going to do with this land that has been, you know, poisoning people, but it can be, you know, what can we do to turn this into a community resource? And you know, we really think that affordable housing should be a major component of that. And, you know, there's going to be cleanup and things required, and there's going to be other, you know, sure, lots of other great community amenities that people are going to want to advocate for. But, you know, I think it's an interesting example of a place where, you know, there are those direct health outcomes based on where you live. And at least now we're starting to recognize and address some of that. And it's through that health data that are able to show, you know, these long-term impacts. And hopefully that all of this is going to then lead to, you know, obviously better health outcomes for who are living there right now, but also hopefully investment in that community in ways that can provide, you know, more safe, stable, affordable housing for people. So I think it's fascinating, because I think all around the Bay Area, there are examples of where these issues are intersecting and where there are going to continue to be opportunities for people to be involved and really draw these connections.
Yeah. Yeah, most definitely. And I would really appreciate it if you would keep me abreast on how that's moving too. It was just, you know.
Well, it looks like I got one question from Joe.
Yes, hi. Thank you, Darius, for a really great conversation. I'm Joe Price. I'm VP of Real Estate for Life Moves. We're the largest homeless shelter provider in Silicon Valley. And I joined the agency about 3 years ago. And it was a space I was unfamiliar with. And immediately I began understanding that every emergency interim housing shelter was in industrial sites. And I kind of understood that, but what I found out more recently is that back in 2007, under the housing element, every city had to find a land use within its boundaries that would permit emergency shelter or interim housing by right. And so when I heard you, David, say environmental racism, that's how I feel about where all the cities put homeless shelters in industrial zones. So I'm working with the state and local senators now to turn that around, because it's typically, again, it's persons of colors who are most impacted by that land use decision. And why can't, if we're housing, interim housing is the same as single family housing, housing for 6 months, housing for 3 years, it's still housing. We need to be close to transit and amenities. So I'm looking to see if we can push that. So we find you'd have to put it in a permitted use, but a permitted residential use to change that kind of inequity of putting interim housing in industrial zones. Yeah, what's
Interesting.
your view on that?
It's interesting that you said that, and I do think that we're in a place right now where we can start addressing that with some of the state monies that have come down. So, and I forget, I can't recall just the amount of money that has come down for what they call Project Room Key. And Project Room Key was what we had with people. They were having hotels. They were living in hotels during COVID-19. They were having access to living in hotels that were temporarily sheltering places for those that were on the outside. And so there's money now that's available through the state, through Project Room Key, that would take some of the hotels, right, and make them into permanent living spaces for homelessness, right, and to address homelessness. And I think that's a way to go. And I know that as being a working in the shelter area, you probably are able to dispel a lot of the myths about homelessness, because certainly, and this part gets, we see the homeless populations, that people that obviously have some mental health issues and also SUD issues, right? But they don't make up the whole of the homeless population. You have working people with children and families that are living in shelters and that are unsheltered. And I think that has to be, if we're going to make traction on it, then that piece has to be lifted up, because we tend to dehumanize those with the social issues, right? And if you connect the social issues with homelessness, the dehumanization, everybody gets looped into that same narrative, and we miss out on legislation and opportunities to be able to address homelessness as a whole, especially in environmentally safe places. Yes. So.
Yeah. No, and I think Joe's is a great point, because the project that I think that Joe is talking about with Life Moves is also this project in Palo Alto that they're working on, which actually does, to your point, Darius, is also planning to include family units to just look at this exact issue that, people experiencing homelessness, are frequently working people with families, and it's, the siting of this is on kind of an old industrial site. And so I think this is a really interesting issue, Joe. And I think that we should all continue this conversation, because I know that a lot of people have brought this up, and it's come up a lot in some of these recent proposals into where we can easily create some of this interim housing. So let's continue that conversation.
Please.
And I think we're going slightly over our 1 p.m. timeline. So I want to give a chance for, I think my colleague is going to help wrap us up. But before then, I just want to say thank you to everyone for joining us. Thank you so much to Darius for sharing your expertise. And, we can also, if you need Darius's email address, I don't know if Darius, maybe we can drop that into the chat, so that if people want to contact you, and then we'll, as I kind of already gave our action earlier, the 8 essential actions. I hope everyone takes a look at that and then pays attention to SV at home, potential upcoming action alerts around things you can do in those areas. And I think that there's a lot of great stuff that came out of our discussion today that I'm looking forward to following up on and continuing these conversations going forward. So thank you again, Darius. Thank you everyone for attending. And I think I will, is is Allison or Emily going to share something here at the end?
Yes, thank you so much. Thank you, Darius, for a wonderful conversation. Just a reminder that SV at Home is a membership organization. If you appreciate and would like to support our education advocacy and research work, we would love to have you join us as a member. So you can join today at bit.ly/SVH member. We also hope you'll join us at the November HAC. So our November HAC is on the 19th from 12 to 1. It will be on the California Legislative and Budget Update. So another great event. Thank you so much, Darius, for a great conversation today, and we look forward to seeing you all next time. If you missed anything or were a little late to join us, we will also be sharing a recording of the event and have that posted on our website as well. So thank you all. We hope you have a wonderful weekend, and thank you for joining us. Take care.
Thank you.